Good afternoon, Dave. My name is Joan. I'm one of the nurse practitioner students, and today I'll be doing a head to toe examination on you. Do you have any questions or concerns that you'd like to discuss in today's visit?
None.
Okay. So I already did review your history, your medication, and your allergies. Okay. So the next part of the assessment, I'm going to ask a series of questions, and it may seem a lot, but I just want you to answer either yes or no to the questions. Okay.
Sure.
Okay. So have you had any recent weight changes?
No.
Any weakness, fatigue, fever, chills?
Nope.
Night sweats?
No.
Any changes to your skin? Rashes, lumps, lesions?
No.
No. No dryness, itching?
No.
Okay. Any changes in your hair or nails?
No.
Okay. Any headaches? Any head injury, dizziness?
No.
Any ear pain, ear drainage, earaches?
Nope.
Any changes in your vision, double vision, blurry vision?
No.
Okay. No excessive tearing, ear pain, or eye pain?
No.
Okay. Any changes to your sense of smell?
No.
Any congestion or nasal drainage?
Nope.
Any nosebleeds?
Nope.
Okay. Any changes to your condition of your teeth or your gums or mouth?
No.
No sores in your mouth?
No.
No sore tongue, frequent sore throats or hoarseness?
No.
Okay. Any swollen glands, lumps, bumps in your neck?
Nope.
No stiffness to your neck?
Nope.
Okay. Any issues with your breathing at all? Wheezing?
No.
Cough?
None.
Coughing anything up?
Nope.
Okay. And no shortness of breath or pain when you take a deep breath?
No.
Okay. Any changes in your heart? Heart trouble, high blood pressure?
No.
Any chest pain?
No.
Okay. Any palpitations or needing to use pillows at night to help you breathe?
No.
Okay. Any changes to your appetite?
Nope.
Any changes in your bowel or bladder?
No.
Patterns? No. Any heartburn?
No.
Any nausea, vomiting, diarrhea?
No.
No. Okay, good. Any intermittent leg pain with exertion? So if you're walking and
No.
experiencing pain? No. Any leg cramps or varicose veins at all?
No.
Any swelling in your extremities, especially your calves, legs, ankles, feet?
No.
Okay. And you said no changes to your urination pattern?
No.
No burning or blood in your urine when urinating? Okay. Any incontinence, dribbling when you're
Nope.
dribbling or leaking urine?
No.
Any muscle or joint pain?
No.
Any stiffness or arthritis or backaches?
None.
Okay. Any swelling, redness, any pain to your
No.
joints or your muscles?
Nope.
No stiffness, weakness,
No.
moving, everything okay?
Yep. Everything's good.
Okay. And no traumatic injuries to your bones, legs,
No.
arms? No. Okay. Any nervousness, any tension, or any depression or anxiety?
No.
Any episodes of suicidal or homicidal ideation?
No.
Okay. Any changes in your mood, your attention, or your speech?
No.
Okay. Any changes in your memory or having any dizziness or fainting episodes?
No.
No blackouts?
Nope.
Okay. No numbness or tingling anywhere? No weakness to your extremities or anywhere in your body?
No.
No pins and needles feeling?
Nope.
Okay. No tremors, involuntary movements, seizures?
Nope.
Okay. Any easy bruising or bleeding anywhere?
No.
Okay. Any changes to heat and cold intolerance?
Nope.
Okay. Any excessive thirst, hunger, urination?
Nope.
Okay. So now we're going to move on to the physical examination part of the head to toe exam. And before I do that, I'm going to wash my hands. Okay, so now we're going to do the physical examination part of the assessment. So what I'll first do here is I'll take a look at your scalp and your hair. And I'll just look, I'm going to part your hair here, and I'm looking for any lesions, any erythema, swelling. Good. And no tenderness I'm touching here.
Nope.
No tenderness in your face.
Nope.
Anywhere. Okay. And then I'm just looking at your face, looking at any kind of asymmetry again, any redness, lesions, bulges, which I don't see, so that's good. So now I'm going to test your facial movement. So what I'm going to have you do is raise your eyebrows, both, yep, at the same time, good. And then I'm going to have you close your eyes really tight, really try to prevent me from opening them. Good. I'm going to have you smile real wide, yep, show your teeth, perfect. Okay, so now I'm going to test facial sensation. So I have here the, just a broken side of a swab stick, that's going to be the sharp side. And then the dull side would be the actual cotton side, okay? So you just tell me if it's sharp or dull.
Dull. Sharp.
Good. And then the other side.
Dull. Sharp.
Good. Okay, so now I'm going to perform TMJ palpation and range of motion. So what I'll do here is kind of in front of both your ears, around the tragus. I'm going to have you open your jaw and I'll palpate for any tenderness, swelling.
Okay.
Open your mouth. Perfect. And it should, you can close it. And no pain when you did that.
Nope.
And my fingers did kind of fall into the grooves when you opened that. I'm going to test your range of motion. So I'm going to have you open your mouth really wide. Perfect. And close it. Can you move it side to side? Yep. And then jut your lower jaw out. Good. Great. So now I'm going to inspect the interior structures of your eye. I'm just looking at your eyelids here, making sure that they're symmetrical. I don't see any redness or swelling. Looking at the distribution of the hairs on your eyelashes. Looking at your conjunctiva here, the cornea, the sclera, again, noting for any abnormal discoloration on both sides here, and I don't see that, so that's good. So now I'm going to test your pupillary reaction to light. So I'm going to have you stare straight ahead. I'm going to shine a light in your eyes. They should constrict when a light, and there's also that consensual constriction as well. Right, look straight. Good, and the other side. Good. So now I'm going to test your peripheral vision. So what I'll do here is when you see my finger in your vision field, just let me know, okay? Just say now.
Now.
And then the other side.
Now.
Good. So now I'm going to test your extraocular movements. So with my pen light, I'm going to have you follow the pen light without moving your head. Just follow it with your eyes, okay? Just let me know if you have any double vision while you're doing this. And convergence, good. And I was noting if there was any nystagmus, which I didn't see. And then the last part of the exam for the eyes is doing an ophthalmic exam. So I'm using my ophthalmoscope to look at the structures of your eyes. So I'll note your optic disc, the optic nerves, and that cone of light. So I'm going to come in from a 15-degree angle, shine a light in your eye, and just trace the nerves back to that optic disc, okay? I'm going to hold you here at a 15-degree angle. Okay, and on the other side, same thing. Real close here. Good. Okay, so now we're going to move down to the ears. What I'm going to first do is I'm going to inspect and palpate the external structures. So the pinna here. Okay, so just doing a tug test. There's no pain when I did that. No tenderness when I palpated. Okay, good. And I don't see any swelling, any foreign bodies, any redness, so that's good. Now I'm going to use my otoscope to look internally at the auditory canal, and then I'm also going to note the tympanic membrane. I'm also checking to see if there's any foreign bodies, nodules, redness in the ear. Okay. I'm going to pull your ear back here. Okay, perfect. And I see your tympanic membrane. It's that opaque white, a little bit of cerumen, but that's normal. I don't see any redness. On the other side. Good. Again, just scant cerumen, but I was able to see the tympanic membrane. That's good. No redness to the auditory canal either. Perfect. Okay. So now I'm going to do something called the whisper test to test auditory acuity. So I'm going to stand, actually I'm going to have you stand up for this. Okay. I'm going to stand right behind you, turn this way. Right, and I'm going to whisper 2 words, and you tell me what you hear, okay?
Baseball. Apple.
Good. You sit down. So now I'm going to do something called the Weber and Renee test. For the Weber test, it's going to it's going to detect any kind of sensory neural hearing loss. So I'm going to strike the tuning fork and then put it on the top of your head, and you tell me if you feel the vibration on one side better than the other, or if it's equal. Okay.
It's equal on both sides.
Good. Okay, so now we're going to do something called the Renee test, where it tests air conduction versus bone conduction for your hearing. So I'm going to strike the tuning fork, put it behind your ear on the mastoid. When you stop hearing that sound, say now, and put it right next to your ear. When you stop hearing that, say now.
Yep.
Okay.
Now. Now.
Good. And that's normal that the air conduction would be greater than bone conduction. I'm going to do it on the other side.
Now. Now.
Good. So now I'm going to move down to the nose and the mouth. What I'll first do in your nose, I'm going to inspect the anterior and interior nose structures. Sorry. And I'll take a look at the nasal turbinates. I'm also looking at the mucosa and your septum for any tenderness, exudate, any polyps, any kind of deviation. And you let me know if there's any tenderness here.
Yep.
I'm just going to hold your chin. Sorry. And I don't see that here. So that's good. And then on the other side. Perfect. And again, I didn't see any of those findings when I looked in. Now I'm going to palpate the frontal and maxillary sinuses and just test for any swelling, tenderness when I palpate. So you just let me know, okay? Nothing? Good. So now looking at your mouth. I'm going to look at the oral structure. So looking at your dentition here, teeth and gums. I'll check the symmetry of your soft palate, the uvula.
Okay.
Make sure there's no deviation there. So when you say ah. Sorry. Say ah again. Stick your tongue out. Move your tongue from side to side. Good. I was also testing your tongue asymmetry and testing the muscle strength of your tongue. So again, I didn't note any deviation of your uvula, the soft palate, no asymmetry, so that's good. So now I'm going to move down to the neck. What I'll do first here is I'm going to test cervical range of motion. So I'm going to have you move your head, look behind you on one side. Skip this further, and then on the other side. Okay, perfect. And I'm gonna have you touch your ear to your shoulder.
Like this.
Yep, as far as you can. And then bend, yep, other side. Perfect. And I'm gonna have you try to touch your chin to your chest. Yep. And then tilt your head back. Perfect. No pain, no tenderness when you did that. Good. Now I'm gonna test your shoulders, the muscle strength of your shoulders, and then do some range of motion to your shoulders as well. Stand up. I'm gonna have you lift your arms up, actually out, yep, over your head as far as you can. Perfect. Down, and then kind of move your arms backwards as far as you can. Good. No pain.
Nope.
No pain there. Okay, so now I'm gonna have you, you can flex your arms, you bend your arms at the elbow, and I'm gonna have you raise your arm, and I'm gonna push against you, just try to resist my movements, okay? Go ahead. Good, and then on the other side, same thing. Good, good strength, it was equal on both sides. So now I'm going to palpate your head and neck lymph nodes. So I'm gonna start here, submental, kind of move down to the submandibular. You have the tonsillar here, and then I'm gonna palpate the preauricular, postauricular. You have the occipital in the back, and then your cervical lymph nodes, I'm sorry. And then I'm gonna palpate here at the supraclavicular lymph nodes here. I don't feel any tenderness and swelling, so that's good. So now I'm gonna palpate your thyroid gland. So I'm gonna have you tilt your head back a little bit, just a little bit of a hyperextension, so I can take a look here, just to note any kind of gross swelling, and I'm palpating for any nodules, and I don't see that. So now to look at the contours of the thyroid, I'm gonna have you swallow as I palpate, so you can do that right now. Alright, and then swallow as you palpate, and I'm just, yep, so I'm looking at, again, noting if there's any swelling or nodules in the contours of the thyroid. And I don't know any abnormalities there, so that's good. So now I'm going to palpate the carotid pulse. And so you're here at about a 30-degree angle supine, so that's good. I'm going to actually have you just tilt your head, or turn your head to the other side, one side, sorry. And I'm gonna try not to palpate at the carotid sinus here, just because I don't want to occlude that. Perfect, and I'm just noting the that it is palpable, noting the upstrokes here, and then turn to the other side. Good. Now I'm going to take a listen to the carotid arteries, and then I'm going to listen for any bruits, which would indicate any kind of turbulent blood flow. I'm going to actually have you hold your breath. Good. Take a deep breath. And then on the other side, I'm going to have you hold your breath again. Good. I did not hear any bruits there. Okay, so now I'm going to move down to the anterior thorax. So here I will start with your heart. So I'm going to inspect your chest here. I'm noting for any bulges, any swelling, lesions, any kind of let's see, pulsations in your chest, or obvious pulsations kind of by the heart or in your abdomen, and I don't see that, so that's good. I don't see any lesions either. And now I'm going to palpate your chest, and I'll also test for tactile firmness. So from here I'm going to use the ulnar side of my hand, so I'm going to have you say 99 as I move my hand, okay? So I'll start here.
99.
Good.
99. 99.
Good, and it was symmetrical on both sides. So that was good. I was able to feel those vibrations. Now I'm going to palpate your apical pulse, and that would be mid-clavicular line, and it'll be fifth intercostal space. Next, I'm gonna just auscultate your lungs. So I'm gonna listen to your lung sounds and heart sounds, okay? So I'll listen first to the heart sounds, and I'll start in the aortic area. That would be second intercostal space to the right of the sternal border. Move to the pulmonic. I'm just moving down to the tricuspid. Good. I'm just going to listen to your lung sounds here. Take a deep breath. Other side. Didn't hear anything. Didn't hear any adventitious breath sounds. So now I'm going to move to the posterior thorax. So what I'm going to first do here is I'm going to inspect the posterior thorax here. So looking for any asymmetry, any masses, lesions, bulges, looking at the shape and contour of your thorax here. And it's normal for your body frame and size, which is good. I don't see any lagging or any retractions on from your back or your front, so that's good. Then I'll move down to inspection or palpation, and I'm gonna, note any swelling or tenderness, and I'm also gonna do some tactile firmness here. So same as in the front, I'm gonna have you say 99, and I'll feel that with the ulnar side of my arm or my hand. Okay, 99,
99, 99, 99, 99, 99, 99.
Good, and it was symmetrical on both sides. So now I'm going to move on to percussion of the lungs, and then with a tapping motion with my finger here, I'm going to have my middle finger flush to your skin. I'm going to use my pointer to tap to note if there's any kind of abnormal lesions, airs, masses, things like that underneath the surface of. Normally it should be a resonant. I'm going in a ladder-like motion on both sides, avoiding the scapula there. Okay, it was resonant, kind of more up here, which is good. It starts to get more dull down here, and that's normal. Good. So now I'm going to auscultate the lobes of the lungs. Again, moving in that ladder-like motion, listening to both sides for any adventitious breath sounds or any asymmetry. Take a deep breath. Now, deep breath in. Out. Deep breath. Out. Deep breath. Deep breath. Deep breath. Good. And it was clear throughout. And I'm going to do something called egophony and bronchophony. So what I'm going to have you do is for egophony, I'm going to have you say E as I move my stethoscope, okay?
E, 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 E.
Good. If it turned into like an E to A, the E turning into an A sound, that would be abnormal. And then I'm going to do something called bronchophony. I'm going to have you say 99 as I move my stethoscope as well.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Good. And it was muffled and very indistinct throughout, and that's normal. Good. So now I'm going to move down to your abdomen. What I'm going to first do is inspect the abdomen, noting the color of your skin, checking to see if there's any yellow, redness. I don't see that. I don't see any swelling, no masses or lesions, no pulsatile masses that I can see, so that's good. Also checking for the contours of your abdomen, noting to see if there's any bulges in the flanks area or in the near the umbilicus. No, that, again, I don't see that. Also looking at the shape of the abdomen, if it's protuberant or if it's really hollow, or if you look cachectic, which again I don't see, so that's good. So now I'm going to move down to the auscultation of the abdomen. So I'm going to take a listen here. I'm going to listen in all 4 quadrants, okay? Good. And I heard bowel sounds in all 4 quadrants, and that's normal. I'm going to next percuss the abdomen. So I'm using my finger. I'm going to tap. So normally it'll be the tympanic sound, tympanitic sounds throughout, just because there's gas. It is normal also to percuss dullness in the liver area. So here. And that tympanic sound throughout, so that's good. Next, I'm going to palpate the abdomen here. So with my hands, I'm just going to palpate, and if there's any pain or any tenderness that you feel, please let me know. Okay, so I'm just going to palpate lightly here. Again, noting for any masses, any tenderness, which I don't feel. So that's good. So now I'm going to do a couple of special tests here for the abdomen. I'm going to do, the first one is going to be Murphy's sign. And this will test for a possible gallbladder inflammation. So what I'll do here is I'm going to deeply palpate the right upper quadrant. And as I'm doing that, I'm going to have you take a deep breath in, and then cessation of that inhalation, or if there's pain, or due to the pain, is indicative of a cholecystitis, so that'll be positive Murphy sign. So I'm going to deeply palpate here, okay, a little uncomfortable, and then it's going to bring that liver and the gallbladder down. So take a deep breath. No pain? Good.
No.
Again, if you had a hard time taking a deep breath, that would be positive because of the pain. Positive Murphy sign. So now I'm going to move to another special test to test for appendicitis. That would be obturator sign. So I'm going to actually expose your leg here. If you had pain or an appendicitis, you would have pain if we did the obturator sign, which is flexing here and then internally rotating the hip here. No pain?
No.
Good. So now I'm going to inspect and palpate your joints. So first, I'm going to just check the bulk, the muscle bulk, the contours, noting if there's any masses, any swelling, erythema anywhere, in your fingertips as well. Good. And no pain when I'm palpating. Any pain when I'm palpating? Okay, good. Okay, so now I'm gonna inspect the range of motion of your elbow and your wrist. So what I'm gonna have you do is I'm gonna have you kind of bend your wrist towards you. Yep, and then out. Yep, so that was flexion and extension. And I'm gonna have you put your arms out in front of you, and then with your palms up, so that's good. Yep, so that's supination, pronation. Then I'm gonna have you bend your wrist. Yep. No pain. Yep. Upward and downward, and then on the other side. Good.
Are you carpal tunnel syndrome? Because I'm fouling for you.
Okay. So now I'm going to do 2 special tests. The test for carpal tunnel syndrome. The first one is going to be the Tinel test. So I'm going to take your arm and I'm going to tap on the median nerve, and if there was any worsening pain or numbness, that would be positive. So just let me know if you do feel that.
No pain.
It's good. And on the other side?
No pain or numbness.
Good. Thank you. And then the Fallon's test is going to test for, again, carpal tunnel syndrome. So I'm going to have you position your arms, kind of the back of the arms touching each other like this. And then that pressure here, if there was pressure in the next minute or so, usually it doesn't take that long, that would be positive for carpal tunnel syndrome. Do you have any pain?
No.
Good. Okay, so now I'm going to test for muscle strength in your upper extremities. So I'm going to have you raise your arm out if you could. I'm going to push against on both sides. And then I'm going to push down and you just try to resist my movements. Good. Moving down to your elbow. I'm going to have you flex your elbow like that. So I'm going to, again, push down. You try to resist. And I'm going to push you and you just try to resist. So now we'll do flexion and extension of your wrist. So first I'm going to push down on your hands here. Good. And then the other side. Perfect. And now we're going to do your fingers. So I'm going to have you spread your fingers apart. And I'm going to try to push them together and you just try to resist. Good. And then the other side, I'm going to have you put your fingers together. And then I'm going to try to, I'm going to try to keep them together. You try to spread them apart. Good. So now I'm going to test for sensation in your upper extremity. So I'm going to use the hammer to test for sharp touch, this, and dull. So you let me know if it's either sharp or dull. Okay, so I'm going to close your eyes.
Sharp. Sharp. Dull. 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 Sharp. 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 Sharp.
Good. So now I'm going to assess your deep tendon reflexes. Using my hammer, I'm just going to test for hypo or hyperreflexia of the biceps and the triceps tendon. So I'll start with a biceps reflex. So I'm going to have my finger near the biceps tendon here. Okay. And then just strike with my hammer. Good. And then on the other side. Thank you. Same thing. Okay, now for the triceps reflex, I'm going to grab your arm here. Just try to keep it relaxed if you could. Okay, and then on the other side, just have it relaxed. So now I'm going to test your coordination by doing rapid alternating movements. So I'm going to have you have your arms up with the palms facing up, and then kind of stop the top of your thighs, and then do that motion over and over again as fast as you can. Good. Okay, so now I'm going to also palpate your brachial and radial pulses. Radial pulse. And on the other side. Perfect. And the brachial pulse. Good. And on the other side. Now I'm going to do a special test to test for rotator cuff tear. I'm going to have you hold your arms up in front of you at a 90-degree angle, and then I'm going to have you rotate as if you're holding a can in your hand, each hand, and I'm going to have you try to empty that. Yep. And then I'm going to put some downward pressure on there. No pain.
No pain.
Okay, so now I'm going to move down to your lower extremities. I'm going to first inspect your lower extremities for any deformities, any bulges or masses, lesions. I don't see any swelling or erythema in your joints. So I'm gonna just palpate here and you let me know if there's any tenderness. Again, noting any pain or swelling. In your toes here. No stiffness or rigidity. Good. So now I'm gonna palpate the pulses in your lower extremity. So I'm gonna start with the popliteal, which is behind your knee. Yep. And then on the other side. Okay, and then I'm going to do the pedal pulses. Good. And then I'm going to do the posterior tibialis, which is near the medial malleolus here. And then on the other side. Perfect. Okay, so now I'm going to inspect range of motion and then also test your muscle strength while I'm here. So we'll start with the hips. I'm going to actually have your leg up in a 90-degree angle. And I'm going to internally rotate the hip and then externally, and I'll just start on one side and then I'll bring it down. Good. Okay, so now I'm going to have your leg out like this. I'm going to have you bring your leg in, yep, for adduction, and then out and abduction, so that's good. And now I'm going to have you do that same motion again, but you're going to resist my my movements, okay? So I'm going to try to bring it in. Perfect. And then keep that leg in here and then try to bring it out. Good. So now I'm going to move down to your knee, flexion and extension. I'm going to bring your knee up like this, push it back for flexion, and then try to extend it here. Okay, so I'm going to have you drop this leg down. So now against my movements, I'm going to have you try to straighten out your knee if you could. Good. And then on the other side, resist my movements. Try to keep your knee down. On the other side, again, we're going to do internal external rotation of your hips. Go. Okay, so internal here, external, good. I'm going to bring your knee up to test the extension and flexion of your knee. And then extend it. Drop your knee down. And then try to resist against my movements here. Okay, and then try to bring your leg down. Good. Okay, now I'm going to move down to your feet and we're going to test for dorsiflexion. Here, so keep your, yep, resist against my movements, and then plantar flexion, you're stepping on the brakes here. Now I'm going to test sensation in your lower extremities, and you're going to let me know if it's sharp or dull. Okay? Close your eyes.
Sharp. 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 Dull. Dull.
Good. Now I'm going to assess your deep tendon reflexes. So what I'll have you do here is I'm going to have you put your shin over your other shin with your knee flex like that. Try to stay relaxed. And I'm going to assess your Achilles reflex here. Okay. Good. And on the other side, same motion. Yep. Shin over. Good. Okay, so now we're going to move down to the quadriceps or the patellar reflex. Seat here next to you, and I'm going to try to keep this leg relaxed. Okay. And then the other side, just try to keep it relaxed. I'm going to test your coordination, so I'm going to have you take your heel, yep, on your shin, and I'm going to have you drag it up to your knee. Yep, and keep it on the shin and then down. Perfect. And then on the other side, you can drag it up your shin and then down your shin with your heel. Perfect. Okay, so now I'm going to do a special test called the Lockman test. That'll test for an ACL tear. So what I'll have you do is I'm going to have you have your legs up with your knee flexed like that. Perfect. What I'll do is I'll stabilize the knee here by holding it up here, and I'm going to grab. Try to grab the tibia here, and if there's movement or laxity in the joint or bogginess in the joint, that would be a positive ACL tear, positive Lockman's test. Okay. Good. And there was no movement with that, so that's normal. And then on the other side, have you do the same thing on the other side. So again, I'm just trying to move. Good. There was no movement, it was very firm. So now I'm going to do some range of motion of your spine. So I'm going to have you try to touch your toes, kind of palpate quickly, and no pain or tenderness there. Okay, good. And then I'm going to have you try to lean back, and I'm going to try to support your lower back here as far as you can. Lean back. Good. Now we're going to do a little bit of rotation here. So I'm going to have you rotate, try to touch your arm to the other side with full extension of that side. Perfect. And then on the other side. Good. And now I'm going to have you do lateral bending. So I'm going to support you on the side here. So really just try to touch your arm to your lower leg if you could. Yep, on the same side. Perfect. And then on the other side. Good. Now the last thing I'm going to do here is a special test to test for meningitis. Something called Brzezinski sign. It's a little test for flexion of your neck. When I'm doing this, touching your chin to your chest. If there was movement to your hips or your knees, that would be a positive Brzezinski sign. Again, so I'm going to do that again, and just noting any movement to your lower extremity here, your hips and your legs, and I don't, and there's no pain there, right? And that's normal. Good. Okay, so the last thing we're going to do is inspect your gait and your position. So I'm going to actually have you walk 3 or 4 steps forward, just like your normal walking. Perfect. Turn around and come back. Good. And I was just noting to see if there's any asymmetry, checking the movement of your arms, looking at your stance, again, your gait, were you able to keep your balance, and that was all normal. Now I'm going to have you walk heel to toe. Okay, so I'm going to have you put one foot right directly in front of the other, heel touching your toe. Yep. And then do that for 3 or 4 steps. And then come right back. Good. Perfect. So now I'm going to do something called the Romberg test, a test for sensory ataxia. So for this test, I'm going to have you, as you're standing right now, kind of with your feet together. Okay. I'm going to have you close your eyes. And I'm just checking to see that you maintain position for 30 seconds. A little bit of swaying is normal, but I see that you're able to maintain upright position, so that's good. Okay, so that concludes the head to toe assessment. I am going to order some regular labs for you. Do you have any questions regarding the exam?
Nope.
Okay, everything did yield within normal limits, so that's good. If you do have any questions, please let me know.
Thank you.